Hi, I'm Barnstable County Commissioner Bill Doherty, and it's my pleasure to welcome the viewers to another edition of County Chatter. County Chatter is a program that's intended to give the viewers some idea of some of the regional programs and support services that are available here on Cape Cod. With me today is Sheila Curtis, the Executive Director of SHINE, and I'll let Sheila explain what SHINE, that acronym, means.
Sure. Thank you, Bill, first of all, for having me come today. SHINE stands for Serving the Health Insurance Needs of Everyone. It actually used to stand for Serving the Health Information Needs of Elders. But when Medicare Part D came around in 2006, we weren't just seeing elders, we were seeing under 65, those with disability, because they're also on Medicare. Mm-hmm. So we decided to change what what SHINE stood for. So we now serve anyone who is on Medicare, not just elders.
Well, I think that's a wonderful thing, since I think I'd estimated there was over 40,000 people on Cape Cod that have been identified as meeting the federal criteria for disability. Not to mention the 24% of us that are over 65, and the 31 or 32% that are over 55. So there's a large population out there that needs services, and they have a lot of questions.
Certainly do. Certainly do. Would you like me to just talk about what SHINE,
I'd like
what
you
we
to talk
do,
a little bit about that, because I think that's what viewers, they hear these acronyms and they really don't know what they mean.
Okay, sure. Well, let me just start out by saying that SHINE actually started out as a pilot program here in Massachusetts in the 1980s, and it is now across the whole U.S. The national name is called SHIP, State Health Insurance Programs, but Massachusetts decided to keep the name SHINE because people were familiar with it. And it is funded by the Executive Office of Elder Affairs and the Centers for Medicare and Medicaid Services.
No, is that the one in Massachusetts or the one at the feds?
We're funded by both. We're funded by both the state and the federal government.
Okay.
All right. And it's really volunteers. We have I think it's like 500 volunteers across the state. Here on the Cape, I have 47 wonderful volunteers. They have to go through extensive training. It's 12 full days of training. They have to take an exam to be certified. Then they have to attend monthly trainings with me to get updates, and then they have to be recertified once a year. These counselors are based mainly across the state, mainly in the senior centers, but there are some in hospitals, libraries, but usually it's the senior center where one can call up their local senior center, ask to make an appointment with a SHINE counselor, and they're there to help them with we try to help them through the Medicare maze.
Well, the Medicare maze is something that is an amazing conundrum because the intention is that it's supposed to help people. That's right. And I think to a great degree it does that.
It does.
But in order to be helpful, I think we have to understand it. Now, the first thing I always get confused about is the difference between Medicare A and B, and what exactly each one of them do. Is this a question you get asked a lot?
Oh yes, definitely. Well, Medicare Part A is your hospital coverage. So when you're admitted into the hospital, that is what Part A will cover. It also covers skilled nursing facility if you go to rehab after your hospital stay. Part B is pretty much everything else. It's your medical, your doctor's visits, tests, x-rays, durable medical equipment, ambulance. So basically that's the difference. A is hospital, and then Part B is your medical. Okay,
now within those two, what are some of the kinds of questions you hear most often, your FAQs?
What does it cover? Basically, like Medicare does not cover 100% of everything. There are gaps, like there's a hospital deductible, so we go over that.
How much of a deductible is it?
This year it's $1,216.
A year?
No, and that's where we have to explain to people. It can be more than once a year. Medicare bases everything on benefit periods. So say you go into the hospital. So you would have to pay that $1,216 if you did not have a supplement, if you just had Medicare A and B. So you go in the hospital, you come home. If you're home for 60 consecutive days and go back in, that's a new benefit period. So it starts day one again. So you would have to fulfill that deductible again.
Now, that brings up an interesting point, because I serve on a patient and family advisory committee over at Cape Cod Hospital, and now I understand why there's so much pressure on keeping people from coming back to the hospital, because what they're trying to avoid is, let's say, having people stay in the same benefit period, because although they're reimbursed by by Medicare and Medicaid or Medicare, they do bear a certain burden for doing that, and of course at the same time, people are very concerned about about getting better, and the response, at least at our hospital here in Hyannis, is that they're doing everything they can to make sure that when you go home, you are able to stay at home once you're released, and I think that's a good thing.
Certainly.
Yeah. Now, you mentioned about admissions after from a hospital, an inpatient facility, to a skilled nursing facility. I think it's like a skilled nursing. That'd be
SNF. SNF. They call it a SNF.
SNF. I hear that all the time at some of the meetings that I go to, and SNF. Well, anyway, there's acronyms for anything, but I think that people need to know that. But there's a big misunderstanding and miscommunication that's going on with regard to this, because if you were to tell me that I went into an emergency room, or even if I went into my doctor and he said, well, you don't really need to go to be admitted to the hospital, you need to go to a skilled nursing facility, it would be in my mind that, oh, skilled nursing facility, doctor's prescribing that, okay, but, and now I want you to tell people what the but is.
But, yes. And the problem has increased over the years. What happens is, if someone goes to the emergency room, they could be put in a room for days, but they have not been admitted as inpatient. They're there as what they call observation status, and Medicare will not pay for a skilled nursing facility unless you are admitted as inpatient for 3 days.
I think it's 3 midnights.
3 midnights.
Yeah.
3 days, 3 midnights, yes. And so if someone is there on observation status for 4 or 5 days, they don't know that. And like you said, the doctor suggests they go to rehab afterwards. They think they're covered, and they're not. And they have to pay for the whole bill for that skilled nursing.
There's two things then. One, is there anything being done about this, and what do we expect our viewers to do to help that?
Right. A couple of things. First, hopefully you would have an advocate with you when you go to the hospital, and you need to ask. You need to find out, is she or he being admitted? Are they here for observation? That's the most important. You need to know that. The other thing, there are 2 bills. One is the House Bill HR 1179. And
that's at the federal level.
Yeah, and there's a Senate bill, S 569. They're trying to have those observation days count towards those 3 days. That way the skilled nursing would be covered.
Where is that bill set right now?
I'm not really sure. I know that every member of the Massachusetts delegation has they've all listed as a sponsor for that, but I really don't know where it stands right now.
And that would be Bill Keating in our case, and I believe I do know that his name is on that as a co-sponsor.
Good. So we're hoping.
But if it isn't, if he's listening, he better put it on there.
Yes, and if you know of anyone that have these large bills, please let the Medicare Advocacy Project know. That's a MAP. Have you ever heard of MAP?
No, I haven't.
Okay, Medicare Advocacy Project, they're lawyers, and they will help Medicare beneficiaries free. It's a free service with appeals. So this is something they really want to hear. Anyone who might be out there, they'll help try to appeal. I'm not saying you're going to win, but at least they're there to try to help with those appeals, and they're the ones who really get this thing really going.
Now, how would they get a hold or find out a contact information by getting a hold of you?
They could call me. I will give them the local MAP number, Medicare Advocacy. They're actually on West Main Street in Hyannis.
Now, are they anything to do with legal services?
Yes, there is a lawyer there. He's a MAP. He's one of the Medicare Advocacy Project lawyers there.
Okay, and who pays him?
I don't know.
Well, I
really
often
don't.
wonder about it because,
Yeah, I don't know.
many of us are interested in
Yeah.
advocacy, but we also know that in order for advocacy to be effective, it has to be supported. So in some cases, government agencies, set up an ombudsman or people that are placed, to help. It's almost like the defense counsel that you get, if you can't afford to have an attorney, that's available. But in any case, if someone on the Cape needed some help, at least in the center of the Cape, we could go to West Main Street. Are there any other offices of MAP on the Cape?
Not on the Cape, no.
Okay.
But Tom does go. He goes around to the senior centers and sees people,
Okay.
appointments. So
I believe that you people, that Shine does as well, right?
that we
yeah,
help with appeals. Yes.
Yeah. Well, but I'm talking about. You scheduled yourself into, because I know in Harwich, where I live, I know that in the last time I talked to, I talked to the director over there. She was scheduling somebody from Shine to come in to be available for appointments and to discuss, say, problems that people have. And I would imagine that any senior who was not necessarily disabled but had questions, if they didn't call you directly up at the county, and by the way, you ought to give your phone number up there.
Oh, I will. We are now, that's a good point.
Yeah.
Barnstable County now has the Shine Grant as of July 1st. So I recently moved my office from the Yarmouth Senior Center over to the Barnstable County Complex. So our new number is 508-375-6762. So
6762. Okay,
Yes.
so people should remember that, so that
Yes.
if they need to get a hold of you, they can do that. Also, I believe that if you go to our webpage, barnstablecounty.org, that you can link to the Human Service Department. I think that's where you're
yes,
housed.
Department of Human
Yeah,
Services.
department.
Yes.
And as you were telling me, you're getting all kinds of exercise and going up and down stairs over
Yes,
there.
it's wonderful.
Yeah.
But you're right, they can just call their local senior center too and make an appointment with the Shine counselor. Yeah, that's what they're there for.
Okay. Now, we've talked a little bit about the importance of having an advocate, and I must say that that's one of the things that I had found when in working with this Patient and Family Advisory Committee, that when people are discharged from a hospital, the only thing they hear is that I'm going home, and there is a great need of having somebody with them to, let's say, to ask those questions that that are very important about what is the discharge plan, what is the connection to outpatient care, what are the services that are available. Now, in the absence of that, in the absence of an advocate, is that something that Shine can help as far as telling people where to get services with regard to some of these things that are Medicare eligible?
Well, for health insurance, we would go out there, and if we were out there to help them, say, because we do screen them for other programs, for
Yes.
Mass Health, for the low-income subsidy with Medicare Part D, the buy-in, which pays that Part B premium. So yes, we can go out and screen them to see if they may be eligible. And while we're there, we could refer them or make a call to Elder Services, intake, see if they can get some help out in the home. Or we would call the outreach workers at the local senior center. They're a great resource. They could come out and do a home visit with that person. But basically, we're the health insurance end of it. But we
Okay.
do have, we do make referrals, definitely.
Well,
yes.
I'm going to say that I was at a political meeting on Sunday, and one of the big issues that were being talked about was what the new health insurance programs really cost, and what the and there seems to be an enormous escalation in the out-of-pocket cost. I know that Cape Cod Hospital had reported that their administrative burden on collections has gone way up, because where before Mass Health and some of the other agencies would pick up that what I'd call that gap cost, those are now being put on the consumer, and the consumer is now responsible for it, which means that instead of going after one agency for a pot of money, they're going after a lot of people for little pots of money.
Yeah.
And I don't think that people who had been covered by that really understand their responsibility with regard to that. Now, is that something that that you try to train people or make people aware of?
Sure. When someone comes into us, we go over all their options. I mean, someone can just have Medicare original Medicare, A and B, but there are gaps. The hospital deductible, there's a Part B deductible, there's skilled nursing co-insurance, you know, so there are additional costs. So then we talk about Medigaps or supplemental insurance that can fill those gaps. There's 2 insurance plans in Massachusetts that they can purchase. One, the lower cost does not cover all the gaps, but the other one does. It
Say
picks
higher
up-
risk, lower cost.
Exactly.
Lower risk,
Exactly.
let's say lower risk, higher
cost.
higher risk, lower cost.
But there are other options. Besides original Medicare, a person can join what they call a Medicare Advantage plan.
That's
That's
talk about
Part
that.
C.
I think that that's something that people are not aware of,
Yeah.
because I think that's the one that covers more, but it does cost more.
Yes and no.
Okay.
Medicare Advantage plans are Part C of Medicare.
All right.
And those are the HMOs and PPOs. HMOs are a health maintenance organization, and PPOs are a preferred provider. If you join one of those Medicare Advantage plans, they now have control of that person's health coverage. Medicare is kind of out of the picture. They pay, all right, so say you joined a Medicare, a Blue Cross Medicare HMO.
All right.
Medicare pays that Blue Cross so much per month for that person to be a member. But Blue Cross has complete control as to, you know, can they go see a specialist? Well, that's up to the primary care doctor. They have to get a referral if they're in an HMO. We are original Medicare, you do not. You know, you can go see anyone you want. You don't need referrals. So the HMO is a little more restricted in that sense. You have to make sure your doctor accepts that Medicare HMO. Your primary care doctor has to make a referral to go see specialists. Some of the plans is 17 Medicare Advantage plans in Barnstable County. 17. And they vary from a 0 premium up to $170 or $80 a month. And it's so hard.
$170 a month, is that a family plan?
Nope, they're all individual.
No,
Medicare
okay, so
does not do family
With
plans.
0, what do you get? And what do you get for $170?
And that's where it's tricky. It's so hard to compare them because you have to look at what the copay is when you go to your primary care. Your specialist, it's a different copay.
Okay.
The copay when you go in the hospital is different. So they're all different, and it is just so hard to compare those plans between each other.
Now, I have to say, you know, Sheila, that I'm hearing this, and I'm thinking of all of the frail elders that are out there who must be just out of their mind with, you know, with anxiety about, you know, what's going to happen to me, what's going to happen to my house, what's going to happen to the fact that I'm on a fixed income as it is. You know, so many people do not have the benefit or the luxury of having an enormous pension because they, you know, they were working for a big company, had a lot of, let's say, a lot of responsibility. Most of us, including myself, you know, have very small pensions and Social Security, and that's what we essentially depend upon for, let's say, for supporting ourselves at this time in our life. Now, when we talk about premiums that go from, you see, for example, if you took a look at the top edge of that premium and you were getting, and I think the average for Social Security payments is about between $1,200 and $1,500 a month, that's over 10% of your monthly income.
And that's just the Medicare Advantage premium. You have to pay for Part B also. That gets taken out of their social.
Let's take a look at the maximum cost then.
Okay.
If it's $170 for the Advantage, you know, let's say the gold-plated one, okay. And what does it cost for Part B?
Part B, well, it does go up if your income is higher, but the standard one, it's $104.90 a month for Part B.
Okay, so for an individual coverage, you've got something that is close to
It is. It's close to
$300.
300. It's close to 300.
Oh, wow.
Yep.
And so that's coming right off the top. So that means you'd have to have some type of a part-time job. That's why I guess we see so many seniors bagging groceries and
we do have a
pushing
lot of
carts.
elders, seniors that come to us that are still working part-time.
Yeah. I mean, I must say that I'm anticipating that I'd have to have something to supplement based upon the kind of costs that, that are involved. Now, having said all of that, what do you get if you don't pay, if you have zero premiums? What kind of coverage you get?
Well, once again, the co-pays may be higher, So if you're healthy, that zero premium may work for you. You may go to the doctor twice a year. A $25 copay, at your primary, $45 at the specialist. But if you're having a bad year and you're going into the hospital and skilled nursing, you could end up spending around $5,000. I mean, so it depends on the person's health, really, and it can vary from year to year. So,
I have the benefit of being a part of the VA system because I did wear the funny green suit for a while, and I am a veteran.
Well, thank you.
And you're welcome. And I have the great. Let's see, the great benefit of, thank God, nobody ever shot at me. So, I was there for over 5 years, so they had their chance, but they didn't. So, having said that, I know that the copay that I have at the VA for any pharmacy is, I think it's $25 per prescription.
For 3 months.
For 3 months, and that's another benefit. And the other one is if I go to see a physician, either in Hyannis or down in Providence, it's $50 for the doctor for the copay. Not the copay. That's what I do pay. And if I go to Providence, depending on the procedure, it could go up. It could go up higher than that. And indeed, because I do have insurance, they do collect the insurance, and I think that's a good thing because that means so many more veterans, will have the opportunity to get that. But yeah. So. And I only have the semi-annual physical for my civastatin, regulation. So I'm very fortunate. But when I go there, I see a lot of folks with non-service related disabilities that that are getting care, and they're in there quite often. So I would imagine that $50 copay, which they will not forgive unless you have have an income issue, can be quite substantial on what you have left. Now, is there any relief that you can offer people? I mean, can you direct them towards an agency as far as how do you identify what the let's see, the minimum income levels are where you can expect to get help?
Well, and we would screen them for that.
Okay, so that's an important thing for people to know.
Yes, we screen.
If people think that they don't make enough money or have enough money, based upon let's say the government programs or pension that they're on, that's something you can help them sort out.
Yes.
Okay.
Let me just give you an example. Someone 65 or over, Mass Health, to get on Mass Health, right now your income has to be under $978 for an individual, which is pretty low. And you can only have
every month on that.
And I know, and you can only have $2,000 in assets.
No house.
But they don't count your house.
Oh, they don't?
They don't count your house or the car.
Okay.
But there is another great program out there. It's called the Frail Elder Waiver, and I don't know if you've heard of that.
I've never heard of that.
But it's a Mass Health program.
Okay.
It allows a much higher income. It's $2,163. And they won't count the spouse's income or assets. So if it's a married couple, and say the wife is frail, she has to be frail, and she has to have Elder Services come out and do a clinical assessment. So there's 2 parts to it. So she has to be clinically eligible to be on the Frail Elder Waiver, and then the income and assets. So it allows that person to get on Mass Health with a higher income. Once you're on Mass Health, you can get more services in the home. You can go to an adult day health program, give that spouse some, help, relief, during the day. The wife can go to the day program and the husband can get errands done. But so it is a great program. We're putting a lot of people onto the Frail Elder Waiver.
I think that's a wonderful, wonderful program because I was not aware of it. And when my wife was, she had been, let's say, failing and becoming frail. Of course, I think that I have too many assets. Fortunately,
well,
to be
she
eligible.
could transfer them all to you. You can have the assets. It's just the person applying. So you can transfer between spouses
Okay, so
with no problem.
and the house doesn't count.
Nope, the
And
house and the car
okay.
does not
Oh,
count.
then that would be the major asset that she would
Right,
have had.
and
so that,
so-
I would suspect that a lot of couples out there have this
Exactly.
same thing. They,
It's-
well, this is, I think that, they say that if you get one good idea out of some of these talks, I think that I'm glad we had this
And
little
that's
talk.
what I'd say at my presentations. Even if I help just one person,
Oh yeah.
I think it's worth it.
I certainly hope that people who are watching heard that this Frail Elder Program is the answer to to a lot of things. When we built the handicap access ramp, it was so my wife could get out at least and let's say and have some relief from being in the house all the time. And I would suspect that there's a lot of couples out there that that have that same issue
right.
over time. So the fact that there be some help with let's say with the income eligibility based upon asset counting, I think that's a wonderful thing. Okay, now today we've talked about a lot of things. I think the main thing I was interested in having you come in was the was the concern that I had that people weren't aware that the observation time in an ER did not count towards let's say getting coverage for SNF, for skilled nursing
Under
facility.
original Medicare.
Under original Medicare.
Medicare Advantage is different.
Okay,
but, yeah.
and of course, if they had Medicare Advantage, they would be paying a higher premium. So there's,
Depends.
but it also says that perhaps the most important thing that we could get across in this conversation is how important it is to take advantage of the information gathering and reporting services to get questions answered before you have to ask them, because nothing is worse than being in the middle of what I call a crisis and having to face all of these things, and then also have to find out everything you need to know in order to successfully save your income, save the house, save your assets, before they all get they all get sort of driven away because of your not understanding of how to protect yourself on the cost. But you also provided something else for people to think about with this MAP program, where people could have an advocate that would that would look at your interest and do that. So this this time has gone very, very quickly.
It has gone quickly,
See,
and
yeah,
I didn't even
surprise,
get into
surprise.
Medicare Part D, the drug plan, but
Well,
maybe another day.
We'll do drugs later. But in any case, Sheila, I think this has been, for me, an amazing, opening of stuff that I didn't know, and I thought I knew a lot. I mean, I thought I was a real smart guy, but
I could
think
talk
that,
hours on this, hours.
And I'm going to tell the audience that Sheila's ready to talk hours with you. So if you were to call her at
508-375-6762 or your local senior center and make an appointment with the Shine Counselor. We're here to try to help you get through this Medicare maze, and there's a lot of information that you may not be aware of, and we're there to try and help you, anyone.
Okay, well, folks, there you have it. We've had Sheila Curtis from Shine, which is now at Barnstable County, and I hope that you do take advantage of the offer that you've been made. So thank you very much for watching, and I hope you got a lot out of this, because I certainly did. I'm Bill Doherty, Barnstable County Commissioner, and you have been watching County Chatter.
I can't